Thank you for joining us for another informative, educational, and entertaining edition of Music and Medicine with Dr. Charles Modlin, kidney transplant surgeon, board-certified urologist, public speaker, and well-known community national leader for the elimination of health disparities, dedicated to informing you, the listening audience, about important health topics and health information that you, your family, and your community need to know, while at the same time providing you with quality entertainment, because music and entertainment is medicine. Dr. Modlin's co-hosts are Jerome Brown and registered nurse Jonathan Branch, and the program often includes special content expert guests. So, without further ado, here is the host of the show, Dr. Charles Modlin.
Well, welcome to another exciting edition of Music and Medicine. We have a very, very important program this evening. This being September, it is National Prostate Cancer Awareness Month. And I, as a urologist, that's one of the major disease states that I diagnose and treat prostate cancer. We've talked about this subject matter in the past, but it's very important to revisit this. And again, this is National Prostate Cancer Awareness Month. This is a topic, a subject, a disease that particularly afflicts men of color. So I want to go to my trusty iPhone here and just highlight some statistics about prostate cancer and African Americans. So there's roughly about 260,000 men in America who will be diagnosed with prostate cancer this year, every calendar year. But the incidence of prostate cancer is highest amongst African Americans. So here's some information. African Americans have the world's highest incidence of prostate cancer and more than twofold higher mortality rate compared to their white male counterparts. The incidence and mortality rate for Hispanics are about 1/3 lower than those seen in non-Hispanic whites. So what else? African American males have the highest risk of prostate cancer due to a range of factors, including genetics, racial bias, and we can get into some of this discussion in terms of what that is, and socioeconomic status. Socioeconomic status relates to a situation that a lot of times men of color may not have access to health care, to see doctors, to undergo screenings. Therefore, it's essential that Black males discuss the risk and benefits of testing with a doctor who understands their specific needs. I always say that every man should have a urologist in addition to a primary care provider. Not everybody knows what a urologist is. So a urologist is a surgical subspecialist where we go to medical school, we graduate from medical school, we're physicians and surgeons, but we do a specific internship and residency in what is called urology. And we take care both of men and women, but we're also subspecialists with respect to men's health and obviously prostate health, prostate cancer, even non-cancerous conditions of the prostate are conditions that we treat. So every man needs a urologist in addition to a primary care provider. So what else? One of the most important factors to understand is that prostate cancer is potentially 100% treatable and curable if we can detect it in early stages before it spreads outside of the prostate. That's one reason why prostate cancer has a higher mortality rate in Black men compared to white men, because it's oftentimes diagnosed in later stages in Black men due to delays in diagnosis. And there is some evidence that prostate cancer tends to be more aggressive in men of color as well. The other thing is, whenever we talk about cancer or a number of these other medical conditions, we oftentimes underscore the importance of undergoing or performing research, medical research for the advancement of science, development of newer techniques, newer medications. And, we've talked about this before, and I'll say it again. African Americans, men, are underrepresented in trials, clinical trials regarding prostate cancer. So we do need to encourage our African-American men to enroll in clinical trials to advance the science of medicine. So what are some of the warning signs of prostate cancer? There are 5 major warning signs of prostate cancer. But before I'll go into that, I'll say that most men with prostate cancer who are diagnosed with prostate cancer actually have no symptoms. So you can't just say, okay, I'm fine. I don't have any signs or symptoms. Therefore, I don't need to get screened for prostate cancer. That's not true. And some of these signs and symptoms overlap with just having an enlarged prostate, having prostatitis, inflammation or infection of the prostate. So a frequent need to urinate, especially at night, sometimes urgently, difficulty with starting or holding back urination, weak dribbling or interrupted urine flow, painful or burning urination, and erectile dysfunction, and a decrease in the amount of ejaculated fluid. These can actually be signs and symptoms of prostate cancer. So it's very easy to diagnose prostate cancer. And another very important fact, and I'm going to bring on my co-host in a second, but another very important fact is that Black men should start screening for prostate cancer generally 15 years earlier than their white male counterparts, because we do have a higher incidence of prostate cancer, and there are genetic hereditary components. So Black men should start screening for prostate cancer at the age of 40 years old, whereas white men, unless they have a strong family history, they don't have to start screening until they're about 55 years old. The screening test, generally we like to do what we call a PSA. That's a blood test that tells us, it gives us an indication of what is the enzymatic activity of the prostate. Oftentimes we'll combine that with what we call a digital rectal examination or prostate examination. And if your PSA is elevated higher than what it should be, then we'll recommend a prostate biopsy. Occasionally, we'll order some other testing to help us determine perhaps maybe where we should target our biopsies, with an MRI. That's a specialized form of an X-ray. But no, we wanted to touch on this topic. But today, actually on the show, we have a very special guest, Terrance Afer-Anderson. He's actually a filmmaker, a film producer, and he has actually produced a very impressive documentary on prostate cancer. And we're going to preview on this show, Music and Medicine, this evening, this documentary. It's called The Black Walnut. But we're going to bring him on and let him go into more detail about this. But first, I'd like to bring on my co-host, Jonathan Branch. Jonathan Branch is a registered nurse out at the great Walter Reed Hospital. He's taking care of those active service and veterans. So thanks for being with us, Jonathan. I really appreciate it.
Great to be here, Dr. Modlin. And this is a very important topic. And like you emphasized, this is an important topic for African American men, because we are severely underdiagnosed when it comes to prostate cancer.
And as you've seen as a nurse, a lot of Black men are reticent, reluctant to undergo the screening. They've heard certain myths and rumors about the prostate exam, and a lot of men that, they say, well, if I have it, I don't even want to know that I have it.
Right. Yeah, there are a lot of old wives' tales going around about the prostate exam and all. And a lot of men are, both Black and white, are very embarrassed to get that exam. So, I mean, it is very invasive. I've had it a few times doing physicals. So it is very invasive, but it's very important, and like you said, it's good to know what your PSA numbers are.
Yeah. A lot of times now, as urologists and even primary care providers, a lot of times we'll just get a PSA blood test,
Right.
and not even have to do the digital exam.
Right. Right. Well, I've had them both done. So.
Yeah. So let's bring on our guest, Terrance Afer-Anderson. Are you there?
I am.
Hey, there he is.
Delighted to be here.
Yeah, thanks for spending time with us.
Thank you for the invite, sir.
So can you tell the audience about yourself?
I was diagnosed with prostate cancer back in 2009. And when I was diagnosed, neither of my brothers had been screened for prostate cancer, and they both were. And my eldest brother was diagnosed with a stage later than myself. And that impressed upon me the importance of getting the word out. And I have been working on a volunteer capacity with the American Cancer Society, working with the African American Men's Health Forum. And that's where I was when I was diagnosed. I was where I needed to be. But my brothers didn't have that. So it just impressed upon me, again, the critical importance of getting the word out. I was hosting a television show at the time called Health Watch. And I did at least 2 different editions of the show on African American men and prostate cancer, and produced public service announcement as well, a couple of those actually. But then in 2016, I had the good fortune of participating in a fellowship program conducted by the Robert Wood Johnson Foundation, the Culture of Health Leaders program. And we all had to choose a topic as our culminating strategic initiative. And for me, to focus on prostate cancer, the prostate cancer disparity was an obvious choice. I initially thought about doing it as a play. I've written over 20 plays. And the one thing about a play is that a play is not necessarily as portable as a film. So I thought that a film would be a good idea. And I've been writing for a while, creative writing. And one of the greatest influences on my writing was a gentleman by the name of Rod Serling from the old Twilight Zone. And the reason that I liked his work is because it made you think. There was something that you wanted to pay attention to the story so that you would get what's going on. And so I'm talking about novelty. And I think that even when it comes to film, the American consumer really has a great appreciation of novelty. So I wanted to do something a little bit different, but also that would make it, real impactful. So I did it as a docudrama, and so that I could paint a comprehensive picture of the disparity. I wrote a fictionalized story, but in the context of that fiction, I had 9 prostate cancer survivors appearing in the film, portraying themselves. And at the end of the film, 5 of them look at the camera and give a testimonial. And I have every conviction that the film has been saving lives because there's so many men that are being screened for prostate cancer, the PSA, and the DRE that have never been done before. And a number of those men were diagnosed. So that's basically what the genesis of the film, and why I felt so compelled to do this particular project. And you mentioned the preview. The preview was what we might call an extended trailer, and I think it kind of really sets up the entire project. And at the end of the preview, I'll share a couple of things about that trailer even.
So yeah, how about we just take a look at that trailer now, if we can.
Sounds
it's about
good.
6 or 7 minutes, I believe, right?
Yes.
Okay, thank you.
Whatever happened to Isaac Royster?
a successful defense attorney at the top of his game, catering to those of little means. He met and married Imani Richardson, a pediatric nurse and the love of his life.
It's true, love away. Let's go, last forever.
When I laid eyes on you, I realized that magic lives between heartbeats. And my heart skipped a beat, creating a space that only you can reside. To new beginnings.
Life was perfect.
Oh my God! Isaac! You still amaze me, Isaac. How do you continue to peep into my dreams?
Yes, Isaac couldn't ask for more. He had done everything right. Summa cum laude undergraduate at an HBCU, top of his class at an Ivy League law school, partner in a prestigious law firm. He was covering all of the bases.
Yeah, baby.
Thank you.
I love you.
So he thought.
I'm sorry, baby. It must be the stress from this new court case that I have.
Honey, stress can cause a host of illnesses. I mean, Isaac, you've had some other things going on for a while now. You need to see Dr. Brett. I won't take any more excuses.
Okay. Okay, I promise. Because I know if I don't, you're going to take me to court behind this.
Your subpoena is over there in that nightstand.
Okay. Imani, I didn't know. I should have paid more attention. Hey guys, come here. Look, Daddy loves you more than all the stars in the sky. But you know, sometimes grown-ups make mistakes that they can't recover from. But I want you to know that you and your mommy, you're the best things that's happened to me in this world. And I love you.
I love you too, Daddy.
There is a health scourge disproportionately impacting black men in America. But Isaac listened. He listened to Imani. And eventually he did what he was supposed to do. That was not the case, however, with his brother Irving, also an attorney, yet one who wasn't judicious about his own health. He is the one being buried here today. There is a small gland in men only about the size of a walnut. It is the prostate. If cancerous and left untreated, it can take down mountains. African American men are at the greatest risk. Isaac Worcester's story is just beginning. This is a tale of the black walnut, coming soon.
Very good.
Thank you. Thank you. Those are
Very
extensive credits. I'm glad you're able to stop that. Again, there were a couple of, I won't call them gimmicks, but twists in the preview that you just saw. Most people think that Isaac is the one that has been buried,
Right.
but and then I have him showing up at the end. And the reason I have him showing up at the end is to give people hope, to make sure that people take care of themselves. And on the flip side of that, his brother didn't do that. So I mean that's one of the things that happened in the story. In the film. There's another thing that there's a bit of a gimmick, and I'm just going to put that out there. But you have to see the film to really appreciate what that is.
So how long is the film in total?
The film is an hour and 17 minutes.
Okay, and you're going to be showing the entire film at the upcoming Greater Cleveland Urban Film Festival, which runs from September the 9th through 17th. But your film is actually being shown at the film festival on September the 18th.
Yeah, so they're doing a special showing of the film on the 18th.
Okay, and that's going to be at Shaker Square, from what I recall.
So I'm so sorry. I'm not terribly familiar with Detroit, but I believe that's the location. Yes.
Okay. Yeah, I believe it is, because I'm actually going to sit on a panel, and where I'll be sitting there with you, and we're going to be talking about prostate cancer. We need to fly Jonathan out here to Cleveland to be on that.
Yeah,
panel
I didn't
also.
realize that Jonathan was at Walter Reed. I lived in Washington for a number of years, and
Oh, really? Okay.
oh
Yeah. We're in Bethesda now. We got moved to
right.
Bethesda.
When you guys were on off of was it Georgia?
Oh,
No,
George Avenue. Yeah.
it was Georgia. Okay.
George Avenue. Yeah.
But the film is, it's been an interesting journey. It's been a bit of a circuitous journey as well. But ultimately, I have every conviction again that we're helping people, and I would say with some caution that we're even saving lives, because I know the brothers are going out and getting screened after they see the film.
Okay.
And women play a prominent role in the film, because a sister can get her husband to do what he needs to do. A woman can get a man to get out there to do what he needs to do with his health.
Yeah, that's something that I discovered. I didn't really realize that initially. It was a learning curve for me. So, I started this Minority Men's Health Fair back in 2003 at Cleveland Clinic. We just recently had our first Minority Men's Health Fair this past April at Metro. And I say that to point out the fact that it was a learning curve. It wasn't until I went out and started speaking to women's groups, sororities and other women's groups, that the numbers of men coming into the Minority Men's Health Fair actually dramatically, exponentially, went up. I mean, the women out there in many instances actually play the predominant role in terms of making a lot of the healthcare decisions, for their families. And so we have a great, debt of gratitude to the women. So I'm glad that you incorporated that into the film. And the other thing is, without doubt, you're saving lives. There's no question about it. Yeah. That's not even debatable.
Yeah, I appreciate that. I had an exercise in humility some time ago, and just personally speaking, there was an experience with the Lord, and so I'm just a humble man, but I do believe that it is saving lives. Yes.
Jonathan, one thing I discovered also is that children, whether they're adult children or minor, they're minors, or children can actually play an important role in terms of getting their fathers, their mothers to go get screenings. They can make them feel guilty. We have to use whatever technique we can.
Yeah, absolutely.
Yeah.
Absolutely. And now after the film festival, how can we still see your film?
Yeah, I have a couple more screenings coming up. And after that, I'm looking at making it more available. The reason that hasn't been as immediately available as I would like is because it's been doing the film festival circuit. And so I have some goals with the film to get it video streamed by a network. And so I'm doing the festival circuit thing in anticipation and hope of giving the film greater credibility and credentials so that it has some appeal to a video streaming service.
Okay.
So can you tell us some of the technicalities, and you know, what does it take to produce a film like this? Some of the technicalities. I mean, how long did it take to make this film?
I'll tell you an interesting story. Most often when you see a trailer, the film is pretty much done. And I made a reference earlier that the film has been on a circuitous journey. A real illustration of that is that I wrote and produced, because of the requirements of the fellowship, I wrote, produced, and directed the trailer long before I'd even written the script for the feature-length film. So it was kind of backwards, you know. And, you know, and again, this was my first feature length. So I learned a lot. I gathered good people around me, good technical crew. My director of photography was Greg Boyd, who does phenomenal work. I've used him on a couple of projects. And my cast, again, I use a lot of professional actors in that film, in that trailer. But when you get to the film, that's when you meet the real prostate cancer survivors. I got a lot of cooperation from the city, and I think the city of Norfolk, and I think that's because of the work that I've done as a playwright and a theatrical director. The mayor gave us access to the cemetery. A city councilwoman gave us access to city council chambers, and for that trailer, we turned the city council chambers. We made it look like a courtroom. There is a 24-hour, 7-day-a-week truck stop that appears in the film, and because they are open 24 hours, those scenes we had to shoot 2:00 in the morning. So I had a very dedicated cast, and you know, beyond the technical things, one thing that I learned this a while ago, but especially with feature-length films, a good editor can really make or break a film. And my director of photography also served as my editor, and I was over his shoulder, you know, but I also listened to what he had to say because, you know, he had much more experience than I. And that's basically all that I could think of at this present time in terms of technical things.
You know, Terrance and Jonathan, I'll tell a quick true story, and this is probably 20 years ago or so. Everybody in Northeast Ohio, even, you know, a lot of people nationally know about Reverend Dr. Marvin McMickle. You know, he led Antioch Baptist Church here in Cleveland. He left for a while. I think he went to Syracuse to be a professor. He came back. But I was at one of his talks, again, about 20 years ago or so. And he's a prostate cancer survivor. He actually wrote a book. So this is public information. This is not any privileged medical information or anything. But he wrote a book about his journey on surviving prostate cancer. And I was at one of the talks, men's groups, that he was speaking to a group of men about his journey. And then as we discussed, a lot of men are afraid of being diagnosed with prostate cancer, you know, undergoing treatment, because many men are fearful that they think they're going to become or, you know, have erectile dysfunction. And, you know, during this event, one of the parishioners raised his hand and said, well, you know, Dr. McMickle, I don't even want to know if I have prostate cancer because I'm afraid I'll lose my nature. And Dr. McMickle's, he's literally 6'10", And he paused. He looked down at this gentleman. He goes, "Last I've heard, nobody's having sex in the cemetery." You know, so, you know, but
So
it's true. So we have to put everything in perspective. The thing is, and so erectile dysfunction can be a sequelae of having prostate cancer itself, or just having even a benign enlargement of the prostate. But it can follow treatment of prostate cancer, either with surgery or radiation. But men need to understand, as urologists, there are things that we can do to help them, you know, if they have that problem after treatment. But again, as I mentioned during the opening, prostate cancer is potentially 100% curable if you can diagnose it in early stages. So, you know, I implore the men, black men, 40 and above, get screened for prostate cancer. Go get your PSA blood test. PSA stands for prostate specific antigen. Simple blood test. If that blood test is elevated, your urologist, a lot of times the primary care providers will do the test, and then if they're elevated, they'll refer the man to see a urologist. If it's elevated, the urologist can speak with the patient and determine whether or not it's necessary to do a prostate biopsy. You know, give the patient an informed consent, talking about the risk factors of biopsy. But again, I mean, these are simple things to do. A prostate biopsy takes literally probably 5 minutes to do. It takes, maybe, depending on how busy the pathologist is, it may take 3 days, 5 days for them to read that result. And then we will call the man, tell them whether or not they have prostate cancer. They'll come in and sit down with us, and we'll go through what are the treatment options. I mentioned radiation as a treatment and surgery, and people always ask me, well, doctor, what's the preferred way to treat prostate cancer? Well, by and large, both long-term and short-term survival is equivalent. Radiation versus surgery. There's different types of radiation. Brachytherapy, we call that seeds. There's external radiation, and then there's surgery. Most often these days, surgeries performed by the aid of a robot. We call it radical robotic prostatectomy. Sometimes a urologist will perform it through an open technique. But there's something I need to mention, I didn't mention before. There's different grades of prostate cancer. Some prostate cancer is more aggressive than others. There's a low grade prostate cancer. We call it's a Gleason scoring system. The scoring system is graded 6 to 10. If you have a Gleason 6 prostate cancer, and in some cases 7, you may not, and depending on your age and other factors, you may not actually need to have any treatment right away, if at all. We call that active surveillance. So there's been a lot of advancements in how we approach prostate cancer. So even if you're diagnosed with prostate cancer, that doesn't automatically mean that you have to have anything done. Surveillance is where we repeat the PSA every 3 or 4 months. If you have low-grade prostate cancer, every year or 2 years, we'll repeat the biopsy, make sure that grade is not changing. There are certain situations, depending on the PSA, the grade, where we'll do additional staging with a bone scan and CAT scan. So again, I'll say it again, every man needs a urologist in addition to a primary care provider. So Terrance, again, I mean, we thank you for what you've done with this project. There's no question you're saving lives. We hope people will turn out to this, this screening film festival, September the 18th. It's going to be over in the Shaker Square. What other? You mentioned that you have some other projects you're working on also. What other projects?
I recently did only my second documentary, and this is a genuine, legitimate documentary in every sense of the word. It was on my church. It's called The Angels and the Details. I happened to attend the only African-American basilica in the nation in Norfolk, Virginia. And we recently just did a $6.7 million renovation. And the church was built in 1858. The predecessor of the church was burned to the ground in 1856 by a group called the Know Nothings, because in 1856 they had black people attending the church, and it is believed they were even doing interracial marriages. But during the renovation, I just wanted to document the renovation. We found 2 tunnels underneath the church, and we have great suspicion that one of them played a role a major role in the Norfolk branch of the Underground Railroad. And a couple of things lend some real credence to that. Initially, there was a free black woman by the name of Mary Lou Best, who was a spy for the Union Army during the Civil War. She was a member of my church. At the age of about 23, 24, she purchased a slave boy by the name of Mark Dumati. And why would this free black woman purchase a slave boy? We suspect that she did it to keep him away from his master. Because at the age of 18, when she could give him his freedom, he became a prolific conductor on the Underground Railroad. So if Mary Lou Best went to the church, he no doubt went to the church as well. And one of these underground tunnels, I stepped inside the tunnel and took a picture, and it was headed towards the water. And there was another black man by the name of Sam Nixon, who, if you can believe this is all true story. He was a slave whose master realized that he was pretty brilliant. So he taught him dentistry. And so Sam would make house calls. Now, he was not making house calls to slaves. He had white clientele. And some of the people that he was seeing were the boat captains, the ship captains that came into the Norfolk Harbor, which was near where the church was. And Sam made arrangements with these boat captains to put escaped slaves on their boats and take them up north. So there's just incredible history there. And that particular film has been doing very, very well as well. That was a semi-finalist in the Cannes World Film Festival, Best Feature nominee in the Mykonos, Greece International Film Festival. I mean, it's just been doing well. So I've been very blessed, and so that's the other project, that's currently making the festival circuit. I just last evening I put another one of my films on this platform called Film Freeway, which is something that can make it eligible for festivals. I haven't submitted it to anything yet. I also wanted to make one other comment about why I thought that to do the Black Walnut was important, beyond just that whole thing that the wake-up call that I got when my brother was himself diagnosed. He appears in the film, by the way. In fact, both of my brothers appear in the film. But one of the reasons that I wanted to deliver this message about early detection is because of the way I benefited from it personally. As you noted, a lot of men have grave concerns about erectile dysfunction. For me, I had the brachytherapy done. I had the seeds put in. And it's just, I never had any issues following the treatment. And that's because I got to it early. After the brachytherapy, I didn't have to have any more radiation. My last PSA was like 0.1. And I want to get it even lower, but it's just been a great experience. So that's why I'm trying to get the word out there. But I do love filmmaking. There's something that I just really, truly, I have always known that I wanted to do it, but I just came to it late,
But it's amazing. You telling your story there. It's amazing how much research you have to put in to get to the point where you can actually make the film. I mean, most of your time is probably researching, the subject matter. The other thing, I don't know if your audience. So the Black Walnut is the name of your documentary. And again, the reason why you chose the word walnut is the normal size prostate is about the size of a walnut.
Yes.
So just so that your audience understands that. But Jonathan, we're just happy that we had an opportunity to meet you, Terrance, and we'd like to have you back on the show again at some point.
Absolutely.
I'd love to.
Yeah.
And Jonathan asked me if you would cast both of us in one of your movies.
Yeah. Would
So
you?
I will tell you that that's something that I'm known to do.
Okay.
Because I am a people person. I think that people are completely fascinated because you never know what to expect. People make great subject matter and great source material, and so if someone has the heart to appear in the film or to appear on stage, I'm delighted to have that person present themselves to me. Because I do that, because I will say though that I've been called a hard taskmaster, but it's only because to create character. Now I'm talking about creating character, now fictionalized character.
Right.
To create character, you have to turn your entire physiological being into a work of art. And as I tell my actors, when you're doing that, your countenance, your physical facade becomes like a canvas from which you paint, but you have to paint from the inside. So when I direct actors, I go deep into their psyche and work in earnest to break down any barriers that they might have that precludes their being able to relax to the point where their spirit can flow, their creative spirit can flow. Because I believe that all of us are inherently creative, but it just manifests in different ways. What you do as a urologist, sir, I mean, that's creative work, as well as yourself, Mr. Branch, as an RN. I mean, so that's what I try and do. So that's a long response to your question about putting you guys in the film. Don't be surprised if I come calling.
I put Jonathan on the spot. He didn't really ask that. I mean,
Well, both Jonathan and Jerome Brown look familiar. And I lived in DC for about 20 years, Jonathan. I lived all over DC. I lived on Capitol Hill. I lived the DuPont Circle. I lived all over DC.
And where did you go to church in DC?
Say again?
Where did you attend a church in DC?
I would attend St. Augustine's Catholic Church, but most often I would attend a church in Virginia. My brother happens to be the first African American deacon in the Arlington Catholic Diocese of Virginia, and is at St. Joseph's Church. I have a great fascination for history, and as you noted, Dr. Modlin, research. If you're going to do a film, you have to have a passion for research. I mean, if you want it to be authentic, you have to do your research.
Yeah.
And that's just very, very important to me.
So I wanted to highlight to the audience as we close this out. You can put down on your calendars right now the next Metro Health Minority Men's Health Fair, where we're going to be offering free screenings to all men, regardless of race or ethnicity. It's going to be Thursday, April the 27th. That's the last Thursday in the month of April 2023. We want all the men to take advantage of this opportunity where we celebrate September as National Prostate Cancer Awareness Month. Go out, get screened for prostate cancer, see your primary care doctor, see your urologist. If you don't have a urologist, you can ask your primary care doctor to refer you. We actually work in concert with primary care physicians. We augment the care. We're their partners. The other thing I'd like to acknowledge, Mr. William Reed, for doing the voiceover in the introduction for Music and Medicine. Like to acknowledge Russell Johnson, the producer of this show, K-Hawk 2 Productions. Jonathan, thanks for being with us.
Oh, certainly.
You know, as always, we really love to have you come out here for the health fair next April the 27th. And Terrance, we can talk later,
Yes.
but it'd be nice to actually circulate your film throughout a lot of the churches out here as well. So want to thank the listening audience for tuning in, and then stay tuned. We have many more topics, coming down the pike. So thanks for tuning in, everybody, and we'll see you later. Thank you.
Okay.
Thank you, sir.
Thank you.
Bye-bye.
Bye.